Curtis. I'm one of the analytical leads within the Systems Analytics and Intelligence Unit within the ICB. Amy's joining me today, who assists us with a lot of our admin support and sorting out things like access to the portal that I'll share in a few minutes. So I suppose just a little bit of context really in terms of where we've come from I think it was probably about three years or so ago now that we kind of formed the Systems Analytics and Intelligence Unit, bringing together a lot of the analytical resource within the ICB, and the analysts work across various different topics and areas. So we've got people looking specifically at the urgent and emergency care side of things, other people looking at some of the planning side of the work the ICB does, and for my sins, I kind of oversee some of the work that goes on around primary care and population health management. And one of the things that we started to do is to build some dashboards to really kind of publicize some of the information that is out there, and to enable users to be able to access some of this information, kind of in a self-serving kind of way, really. So it was to try and get us into a position where users in primary care particularly could access some of this information more easily than perhaps they had done in the past. Some of the work was to kind of bring various different sources of information together and put it into one place. So to that end, we developed a portal, a web page, effectively, that holds a number of system dashboards, which I'll share in a moment, and I'm hoping that Amy might be able to put the link on as well. Everybody within the ICB should be able to access the dashboards, but it is done on a there is a permissions aspect to it. So if you don't have access to the link that Amy's just put in the chat, please get in touch with us. Drop your email address either in this chat or go directly to Amy, and we can ensure that you have got access to the dashboards. And I'm sure some of you probably have seen some of these already, but we're just doing this little session here to kind of just remind people of where some of the information is and what they can get hold of, particularly with the primary care network dashboard that I'm going to show you in a sec. The content sort of changed over time because different priorities and different feedback that we've had from people. So you may have gone and had a look at it 18 months or so ago, and it might look a little bit different now to what you might have seen before. And it's just that iterative process really that we have of trying to make sure that the content is relevant and useful, and sort of moves along with some of the priorities of the ICB. So I'm just going to share my screen now, which should take us to so I'm going to take you to the SAIU portal to start with, which is like the landing page, if you like, for the whole of the SAIU. And within this, we've got access to lots of information and lots of dashboards. So I'm just going to scroll down to the place where we've got the dashboards. You'll notice the system information dashboards, and all of these panels relate to individual dashboards that the SAIU produces and updates on a regular basis. And as I say, that's to support various different programs of work across the ICB. The The one we're going to concentrate on today is the primary care network, SID 15, and just a click on there will take you through to that particular dashboard. Just wait for that to come through. There we go. So yeah, there we go. So we'll get to that cover page there, and we can start to just have a quick look at what the contents of the dashboard is. So we've got a whole load of information in here that covers things like end of life. It covers things around the kind of profile of the different populations. We look at aspects of the screening programs and vaccinations, as well as some workforce elements. We have a whole section around the GP appointments data that gets published on a monthly basis. And we've got some other aspects around some of the secondary care and GP referrals. We've also got this link here, which I'll come back to a little bit later, which is where you can get to produce a practice pack, which is effectively a lot of the information that sits within this dashboard, but brought together in a PDF or a PowerPoint presentation format that relates to a specific practice. So in terms of the sort of navigation through the dashboard, you can go either on these links in here in the contents page, or you can kind of navigate down the left hand side here where we've got the various different sections. So I'm not going to go through each of these page by page, you'll be glad to hear, but I'm just wanting to really give a bit of an overview of the navigation and you know, some of the information that held within the dashboard. So the first thing I'd like to just sort of make you aware of is this panel on the left hand side here, which relates to kind of how we view the data. So we can view at a place-based partnership level, we can view at a PCN level, or we can view at a practice level from the vast majority of elements within the dashboard. So as you can see, I'm just on the end of life page at the moment. So we're looking at end of life summaries. And you can see we've got the we're at a place-based partnership view. So we can see this particular measure, end of life patients, at Basset Law, Mid Notts, Nottingham City and South Notts, looking at various different measures across there relating to end of life. We could look at a PCN view, so that's just a simple click there that starts to look at the PCN, and you can then filter with these other elements in this panel here. So if we wanted to just look at the PCNs within, let's say, Mid Notts, we could do that. So we're at PCN level for Mid Notts. If we wanted to look at practice level, click on the practice. And then again, you can then start to filter. It brings the data back at practice level. But if you wanted to just look at one particular PCN within Mid Notts, you could do that. And you can sort of start to get to hopefully a bit more of a practical view of where things are. We've got this panel on all the pages within the dashboard. And I think it's one of those things where you just get to know how to navigate that panel. Sometimes you have to click back on something you've already clicked to open up the other options within the filter. But ultimately, yeah, we've got that place level, we've got the PCN level, and we've got the practice level. Within the dashboard overall, it holds loads and loads of information. So we've kind of tried to build build the content, and put the different buttons in, so you can kind of you can move through different views of information. You can see here we've got the percentage of patients with respect forms in place. Again, we're looking at a practice level at the minute, but if I want to jump to a PCN level, starts to thin out the information coming back on the bars. And also you'll see we've got a button here that allows you to look at the current position, but we've also built up a trend view, which is a bit messy when you're looking at PCN. But if you start to filter down, you know, you can start to hopefully get a better view of things on the trend view, depending on how you use those filters. So as I would just stress that if you can get to be happy with the way the filters work, that will come into play in the rest of the dashboard as well. So we've got that end of life section. We've got the population view as well, which we kind of, it's more like a sort of profiling view, I suppose, of either practices or PCNs places. So here we've got the age profile. So often we used to be turning around requests where projects came in and wanted to know, or could you tell me what the situation is in terms of how many patients I've got in certain age groups. So we can start to filter on this if we want to, with the slider, if we wanted to just look at a particular age group band, within, as I say, any of those geographies around the side. So we've got something around age profile. Recently we've added something around the clinical frailty scores and the number of patients who we have recorded in each of those CFS bandings. So that's something that's relatively new. We've got some views of deprivation as well that we can, again, you can sort of just filter across various different geographies. We've also got something around the segmentation of the population. So this is sort of a nod to the work that's been done with in terms of population health management. So we can start to look at how many patients, or the proportion of patients that fit into the particular segmentation or segments that we've created within the ICB, to help with some of that targeting of where we want to get certain interventions in place and things like that. So the population section, as I say, gives quite a bit of information around the sort of profiles of PCNs or practices. We can move on a little bit more to the various measures around the GP appointments data. So no, we have to take this with a pinch of salt, because there are still some data quality issues with the GPADS data, but we as an ICB are getting monitored on some of these things. So we've had to kind of go with what gets published. So again, really, this information all gets published by NHS England, but in a format that's not particularly helpful to look at. So we kind of transform it in the dashboard, so we can start to look at where we lie with some of the specifics that we're monitored on around patients being seen within 14 days of booking, for example, which is one of the areas that we look at fairly regularly. And again, you can start to look at that at a place level or a PCN or a practice level, to kind of see where practices are with that particular measure. We also look at things like the appointment mode, and the attendances and DNA rates that come through on the GP appointments data. Quality. We've got some of the screening information and vaccinations that we can pull, that we can show both as a sort of snapshot view of where we are, but we can also shift to trend view as well. Again, same kind of filtering on the left hand side, but there's lots of information here that is pulled out of the GPRCC and practice systems to be able to kind of view where some of these measures are. Saying got quite a lot there with the child vaccinations as well. Workforce, again, that's a return that practices make, and then it gets published by NHS England. So this is really just as a case of us trying to turn that around and put it into some sort of useful view that gives us that ability to check through at practice level, PCN and place. As I say, yeah, there's loads of metrics even within one of these pages. So I think it's one of those things to, if you got that time to have a look and just to navigate around, then hopefully there's things in there that you will find useful. In terms of the general audience for the dashboard, it's quite broad really. So there'll be some things that absolutely you will be interested in, and then there'll be other things that perhaps someone else in the ICB might be looking at. But yeah, again, that's just based on information that comes through from NHS England. We've got some of the primary care access and recovery plan measures. So this comes back with some elements that are just at an ICB level, and some elements that are published through the ONS Health Insights survey. Again, that's just at ICB level. We have got some elements that fall down to PCN level and practice for. We've got some of the calls data that's starting to come through now that we're starting to publish. We've got elements of secondary care that we kind of keep an eye on. So those patients that are discharged from hospital outpatients departments where they've been referred by GP, but are discharged at the first appointment. We look at the numbers of A&E frequent attenders, what might be deemed as inappropriate A&E appointments as well. Again, very, lots of different views of from a geographical perspective of what's happening there, and we've got the the details there of the time of arrival and things like that, which we'll pull through. There's some referrals numbers as well, which we look at in terms of 2-week wait, non-2-week wait, and advice and guidance, broken down by specialty. That can be seen there. So again, rates of GP referrals per 1,000 population, which is that's a crude rate view of the world, but in other things we do look at things with a standardized rate. We've got some the IAPT referrals as well that come through there. One of the other areas that we look at is kind of practice level indicators. So we thought of try to have a look at where a particular practice sits with a number of indicators. Some of them sort of sit within 4 domains really. So we've got the resource domain, the quality domain, prevention domain, and the access domain. And yeah, these are things that have been highlighted from some of the primary care team within the ICB that are kind of wanting to keep an eye on to see how practices differ and where we've got variation and where there can be supporting practices with some of these measures. So that is a really kind of quick overview of the content of the PCN dashboard. What I would like to also show you is where you can go to produce a pack of information that specifically relates to a certain practice. So if users go to the contents page, you'll see that there's this button here that is a link to the practice pack page. So if you pick that, it will take you through to a page where you can start to you can pick your practice. So if you go through to this page and you say, oh well, this is showing Nottingham City, but I'm in Mid-Notts, you just need to click on the practice that has been already picked, and it kind of opens up the filters. Sometimes you just need to do that to get to the full view of practices. So then you can pick your place, pick your PCN or pick your practice, click on that practice, and then the instructions up here just tell you how to actually get to the export. But effectively it's just a couple of clicks and you can choose whether you want to export to PowerPoint or PDF. That will probably take about 30 seconds for it to run, because it's kind of done it's done in a sort of live way. But once you get through that and you can download the pack, this is the sort of the view that you start to get. So again, we can work on the details of the content. We've sort of had some discussion with various GPs and the primary care team about what we think is useful to go into the packs, and yeah, it brings back a kind of an element of benchmarking with the different measures that come through. So with this one, we've got, this is the segmentation view of a particular practice. So we've got the segment 1 looks like this for a particular practice, and then what those numbers look like at a PBP, the relevant PBP, and the ICB overall. So we kind of we're giving that element of benchmarking as well. Yeah, it's various different things that we're looking at, and we've got some trend views as well of some of the measures, where we are with the here this is looking at the clinical frailty score recording values and how that's been changing over time. And as I say, there's a whole bunch of information that goes in here, and hopefully there's things that highlighted that could you know, that are going well, and those that are not going so well within that pack. So we've done that over, I think this has been around for the last 6 months or so, which we know, we can see where they've been used and people are downloading them. So so that feels like that's been it's a good thing that's out there, and enables people to kind of get that practice view of the world. What we're trying to do with this is get to a point where we can offer some narrative to go into that pack as well. So we're just sort of looking into the possibility of effectively using AI to kind of summarize the view of what's in the pack, so that you don't have to kind of sift through. I think they run to about 20 odd pages of measures and statistics that come through. So we're trying to get to a point where we've got we utilize the AI function that we've got to try to produce like a narrative that will enable users of the packs to kind of pinpoint where things might need looking into, or where things are flagging. So yeah, that's the PCN dashboard in itself and the practice pack. I think if we want to just pause there, I'm happy to take some questions or anything that anyone wants to throw our way. That's fine.
Thanks ever so much, Chris. That was really, really useful. I'm just going to check the chat and see if there's any questions in that first of all. No questions in the chat. So I'll hand over to our attendees. Any questions at all for Chris and Amy?
Can I just ask a question first?
Please go ahead.
Has anybody already downloaded the pack or used the dashboard so far?
We have a hand up. Go ahead if you'd like to speak. Go ahead,
hi.
Please.
Hi, Sarah. I'm working with PCN. So I download each month and share it with my practices.
Wonderful. Thanks, Sarah. Does anyone else make use of it at all? So I haven't used it personally, but I've had assistance of my assistant practice manager who did do it, and she sort of used it to gather the data that I was looking for, and then handed the data over to me basically, but she actually did the searching for it and found all the information on there that I wanted. So I've seen it in action, but I've just never actually used it myself. Ros Reval from Roundwood Surgery actually has a really useful question in the chat, if that's okay. How do you investigate the data if you think something is incorrect?
So happy for people to come through to us. We utilize effectively what's coming out the back of some of the practice systems and some of the other data sources that we use. So for example, I think the other day I'd got a query about something around the workforce data and some ratios of things that the user was not thinking were looked accurate, and we kind of looked into some of that stuff, and it was coming out the back of the workforce submission that practices made, and I think there was a change made to the count of fully qualified GPs or whatever particular element it was that was causing a problem. So yeah, we kind of try and turn around the data as we receive it, but if there are things that look like they're incorrect, then please do come back to us, and we can start to have a look and see if we can unpick why something's looking like it is.
Thanks, Chris. Any other? I think we have another hand up. Go ahead, please.
Hi. On the back of the my original question with the data, because obviously having looked at the pack as we've you've been sharing, I've been trying to do the same. I've struggled to download my personal practice pack. It's all I get is something went wrong, please reload. And I've looked at some of the data that relates to my practice, and I don't appear it doesn't look quite right. So that's why I asked the question. So I did look at workforce planning, and I kind of think, I don't think I've got that many. So it's how do I drill down to where that data's coming from to go and then correct it, so where you're extracting it from is then correct.
Yeah, so I think it like I say, with we're kind of turning around what we see. So if there's something that looks incorrect, I think it's probably easier to have a conversation with us. You could say there's loads and loads of information that goes into the packs and into the into the dashboard, but happy to have that conversation to sort of just try and drill down to where we think the issue might be. There's such a kind of there is a document within the contents of the dashboard that tells you where the sources of information are coming from. So there's a sort of way to start to have a look at some of that stuff. But it might be easy just to have that conversation and come through to myself or to Amy, and we can work through those queries if you think there's something that looks wrong, and we can sort of try to direct you to where things might look, things need to be changed or what have you. With some instances, it can be around the way things are coded into systems and some of the forms and templates that are in place, and which particular SNOMED codes are being picked up for certain things. So we have had some of that where we've worked the picture that was coming through on the dashboard was not reflective of some of the things that were actually happening in a practice. And once we kind of worked through the what was happening with the coding, some of the coding was able to be updated, and we were able to, that picture sort of changed when we got that coding changed.
Mm-hmm. It's just obviously my workforce. Can I have that many GPs, please?
Yeah, absolutely. Yeah, we'll see what we can do.
That would be great. But if we're being monitored on this, or somebody else is looking at this as a whole, and that data is not quite as it is in real life, it's like, oh look, Roundwood have got all those GPs. No, I haven't.
Yeah.
So where's that data coming from, so we can actually correct it? And it's the same
it'll be
with
the
appointment.
It'll be the NW. Is it National Workforce?
Yeah.
National Workforce Service survey return that will be coming out of. So
but that's
that
the worry,
might be something.
because I know mine's correct for the number of GPs on there. So where's that figure coming from if that's different?
Okay, we could happy for us to have a look at that.
Okay, thank you.
That's right.
Thanks, everyone. Any last questions for Chris and Amy at all? Or anything you want Chris to perhaps share again on his screen, if there are any questions you've got about doing the search, or any queries about the actual locations of things on the database?
Can I ask then, how do we get the practice packs to be downloaded?
Yeah, okay, let me share my screen again. So within the gosh, got all these pictures coming up. So within the contents page of the PCN dashboard, we've got this link to PCN to link to practice pack button. And when you press that button, that will take you through to a page which is a bit ugly, but this is where you can choose your practice. So if you want to look and choose your practice, you can do that here. So any practice there, and then you go to the top where it says export. Choose the drop down, in the drop down the version that you want, whether that be PowerPoint or PDF, and then it'll come with this page. You just press that export, and then that starts to create the pack. And as I say, that normally takes 30 seconds to a minute to kind of to produce, and then it will you'll get a download either shown at the top of your browsing window, or it'll be in the download file folder within your Explorer.
Forest, wasn't I?
Okay, sorry, I don't mean to be thick, but I'll ask the question. But I can't get past the content sheet on my screen. So where you've got the practice pack at the bottom, all I've got is a content sheet with listed. So how do I get to the...
If you just click hide data updates at the top, the button.
Oh, right, you got...
I haven't got hide data, but because that's what I did before. And I've gone back to it, and I've got no button for hide data updates anymore.
So you're in that page. Are you Are you seeing that page there?
I see that page, but where you've got the button where it says hide data updates, I don't have that.
It's not, and it's not a scrolling at the top. It's not there at all.
It's not there at all. I've got no scroll bars, buttons.
I don't know why that would be. Is there anyone else seeing this? Is anyone else able to check if that's something that's a problem on other people's view?
I see that button on my view.
Right.
So I can hide it.
So you can, right, okay. Ros, we might have to take it offline and have a look at what's going, and just go through what's going on your screen then. I don't know why that would be.
That's okay. I've always been unique.
But we're happy to have a look at it and see what's going on there.
Okay.
But that's how we would normally get through to the section where you can choose your practice to create a practice pack.
May I just say, Wells, there are a few comments in the chat which might be beneficial. Some of our colleagues are saying that the icon for it's at the bottom of the screen and not on the side. So I wonder whether the layout, for some reason, might be different. I don't know why it would be, but I think Emma from Muster's Medical Practice says that hers is at the bottom of the screen.
I wonder. Yeah, I don't know. I've not come across that before, so happy for us to have a look at it and see whether it is to do with the layout. I'm not sure. Really don't know, but we can have a look at that and try and get some clarification out there.